need people. And that's a schizoid personality. It's not like I hate you. It's not that I dislike you. It's not like I don't want to be a part of your life. It's just that I don't, they just don't need anybody. I don't need anybody. That's what they're thinking. I don't need anybody in my life. And so, why is that cluster 8 that we talked about? Why is it called the odd or eccentric cluster? All right. Why is it called the odd or eccentric cluster? So, cluster A includes the paranoid personality that we talked about yesterday. It includes the schizoid that we're talking about today. And then there's also schizotypical personality disorder, which we will look at tomorrow. They are usually, it's called the odd and eccentric because people with these conditions often seem like the other. They feel detached from the norm. All right, and they usually very different from the typical social expectations. Is that making sense? So those of you who are joining me, say hello and let us know that you're here. This is our 30 minutes looking at personality disorders. This when we're looking at the cluster A, which is the first 3 days of what we talk about. Yesterday was paranoid, today is schizoid, and tomorrow is schizotypical. They're usually a little bit apart, a little bit like the other. Their thoughts, their emotions, and their behaviors usually don't match what most people consider normal. Of course, we have to figure out what is normal, right? So it's not about being strange. It's not that it's just about being disconnected from social norms, from social expectations, from emotional expressions, and in relational warmth. There is no warmth with this particular group. So think of cluster A as existing on a spectrum of social distance, socially remote from social distance. So paranoid personality disorder sees the world as dangerous, like we talked about yesterday. Schizoid personality disorder sees it as irrelevant. This it's just irrelevant. The world is just this whole thing, this whole system is irrelevant. And then the schizotypical that we're going to look at tomorrow, personality disorder actually experiences the world in a mystical or distorted prism. And that's going to be interesting tomorrow. Yeah, so cluster A isn't just about being weird. It's about feeling this sense of detachment from social life itself, if that makes sense. So what is the schizoid personality disorder? The one that we really want to look at today. The schizoid personality disorder I want to look at today. Schizoid personality disorder. What is that? This is a long-term pattern of detachment from social relationships. They're detached from social relationships, and they have very limited emotional expression. Very limited. The affect is usually very stifled, right? These individuals usually appear like they're withdrawn, and I'm not talking about shy people. They appear like they're withdrawn. Sometimes they can appear like they're cold and arrogant or just indifferent. They're just indifferent. It's not because they dislike people. It's not that they don't want to, they don't, it's that they don't, that they hate people. They simply don't feel the need to be close to anybody. They don't want to be connected. They don't want to be connected. This person is very stoic. This person is pretty much into themselves. And it's not about, like I said, it's not about being shy. It's not about shyness. It's not about introversion. No, introversion just means you get your energy from inside of you. So it's not about introversion. Of course, extroversion means that you get energy from outside. And so it's not about introversion. Because introverts want meaningful relationship. Introverts want connection. Introverts want to be friends. They want relationship. But a person with SPD, with the schizoid personality disorder, often feels emotionally self-sufficient. It's like they have everything they need. They are emotionally self-sufficient, and they prefer solitude over any social or romantic engagement. They don't see the need for you. They don't see the need for the other person. They don't see the need for you. They don't see the need for the other person. So an example is, so imagine a coworker who always eat lunch. They're always eating lunch alone. They never join the group chat. They rarely react to praise or criticism. They just do their job quietly, then they go home. You might think they're unfriendly. That person is so unfriendly. That person doesn't engage. But inside, they're just content. They are content being alone. That's the inner world of the schizoid personality disorder. In a world where people are connected, we are connected beings. We are interconnected beings. That's the way that's the basic human experience, is interconnection. The schizoid personality doesn't feel the need for that. So the introverts, like I said, wants connection in small doses, right? But the people with schizoid personality disorder do not want it at all. That's the biggest difference. So the introvert wants those connections. They want it, but they just want it in small doses. They don't want to be overwhelmed by it. But the SPD does not. Person with SPD doesn't want it. That person doesn't want it at all. That person doesn't want it at all. So think of Daniel, or Joe, who lives alone. His mother calls him often, but he just lets the phone ring. Anybody, siblings will call him. It just doesn't. It doesn't want to pick up the phone. He loves her. He loves the mother. He loves his siblings, but feels overwhelmed by emotional conversations. When they're having this emotional conversation, it's just overwhelming. He doesn't want to do it, so he's going to visit, the home once a year. He's going to sit quietly and leave early. He doesn't argue. He doesn't fight with anybody. He just prefers his peace to closeness. So he's going to choose his peace, his solitude, over closeness. And you might have somebody at work who's also like this. So you have somebody who is very responsible, they're very punctual, but they're totally invisible. They do not want to be seen. They rarely speak during meetings. When promoted, it's neither here nor there. They're not happy, they're not surprised. It's just the way it is. This person might not complain, will never complain. They don't need you to explain things to them. They'll figure it out. Right. And so even in relationships, in just normal relationships, they will end the relationship quickly. A lot of the times they will end it if you start asking for intimacy. If you start asking for emotional intimacy, they can't handle that. This person is very transactional. They can't handle that. And so they will end that relationship. They will distance themselves from you because they don't want to be overwhelmed. All right. So if you're paying them compliments, if you're very affectionate towards them, if you're making romantic gestures, this just feels very intrusive to them. They just feel like you're invading their space. They feel like you're invading their space. So this person will rather have companionship, if at all. They'll rather have companionship than any kind of intimacy. They don't want any intimacy. They don't want any intimacy. They don't want any emotional labor. Just, come home, they know exactly what's going to happen, and that's it. And so it isn't that this is not about hostility. This person is simply detached, and their emotionality is flat, and sometimes they're often misread, and people think that they're arrogant or that they are cold, right? They're not cold. They are disconnected. All right? They are disconnected. The schizoid personality disorder is emotional distance, not cruelty. They are disconnected, they're emotionally distant, but they're not trying to be mean towards you. That's just the way the world has evolved, right? So according to the DSM, right, when we're looking at the at schizoid personality disorder, it says that it involves a pervasive pattern of detachment and restricted emotional expression. Beginning usually begins in early adulthood. And they will show four traits, people. They will show four traits. Four of these traits. They're going to show four traits. The first, we've talked about it a little bit, but they neither desire nor enjoy close relationships, including family. They don't want it. All right. And they're almost always going to choose, number two, they're always going to choose solitary activities, things that they can do by themselves. That's the person that goes off by themselves into the wilderness to go hiking. They live up on the hill where there's nobody 20, 30 miles away. They have little interest in sexual experiences with another person. They're not interested. It's too close. They're not interested in that. They take pleasure in very few activities, if any. Some you might find a few who would actually enjoy one or two things, but most of the time, nah. And they appear indifference to praise or criticism, and they will show emotional flatness, or they might seem emotionless. And you're like, is this a person? What's going on? Why can't you show feelings? The traits help create an invisible wall. They don't seek approval. They don't react strongly to anything, to any kind of rejection. They basically just live functional lives without emotional bonds. So they're functional. They might rise to like CEOs. They might be your boss. They might, they would live functional lives, but there are no emotional bonds. So if you know someone like this, and if you are that person, then hopefully this is helping you. And it might be difficult if you don't understand what you're dealing with. So make sure you join healing. Join healing. We're going to do a healing boot camp at the end of the 10 days of talking about the 10 personality types, the 10 personality disorders. All right. So imagine someone that praise doesn't excite them. If you tell them, "Oh, you did a good job," why did you do that? It doesn't hurt them. That's the emotional flatness of SPD. Quite emotionally flat. If you have a child like this, it could be worrisome. You're like, what's going on with them? If you have a relationship with somebody like this, it's something that you want to look at. So what are some risk factors? What are some exposures that will, we don't like using the word causality in social sciences, right? Because you can say it's not HIV because it's AIDS. There's a lot of relationships, there's a lot of correlations, but we don't want to have causality because, you can have the same set of people exposed to different variables, and they will react different. Same variables, and they will react differently. So sometimes it might be subjective. But one of the things we do know, though, that childhood stuff might impact the adult with SPD. Many people have said that individuals with SPD usually have experienced emotional neglect in childhood. They've been emotionally neglected. So the child learns that emotional expression brings no reward. It brings no reward. There's no punishment. They just stop trying. So the neglect then makes them to stop trying. So, or if you have a distant or very cold caregiver who doesn't show emotions, that person then, or the caregivers, can teach the child that self-reliance equals safety. Self-reliance equals safety. So over time, the child grows into an adult who doesn't expect comfort from others. There's no need for it. There's no need for it. They don't expect comfort from others at all. There, then there's sometimes we see that there might be some genetic overlap with schizophrenia, with spectrum disorder. But we have to be clear that people with SPD don't experience hallucinations or delusions. All right, so that's important. But when a child learns emotions are unsafe, adults can feel safer with that. Like adulthood can feel safer without them. So when that child learns emotions are unsafe, this is unsafe. This hasn't worked for me. So when they grow into their adulthood, they just feel safer without those emotions. It feels safer without those emotions. So at work, people with SPD are reliable, but they're detached. So you see the good and they're reliable, but they're detached. They're rarely team players. They don't want to have group projects. And they might not even go for promotions if it demands leadership. And in relationship, it seems as if they're just emotionally absent. So you're at their partner, you're going to say things like, I don't know what you're feeling. I don't know what you're feeling. And the schizoid personality will say, oh, look, I'm fine. And they're going to mean it. They're going to mean it. I'm fine. In friendships, they appear like, they're not there. They can disappear for months without explanation. They're not angry. They're not, they're just, they're just tired. They're just emotionally fatigued. It's like, I'm done. I need to get away for a few months. I need to get away from the. So the disconnection can then lead to misunderstanding. You as a friend are like, what kind of friend is this? How do they just check out? They just check out and they don't show up. So that can now cause conflict. And the more conflict you now begin to experience and verbalize, the more you push the schizoid personality away because they don't want to be a part of it. They don't want to discuss it. They are disappearing not to punish you, but because constant emotional energy drains them. They can't do it. They can't handle it. So they're going to go. Now, is it possible that there's treatment for this? Is it possible that you can heal through connection? Is it possible that you can learn to actually be a part of this world and bond with somebody else? Yes, the answer is yes. It takes time, but if you seek help, you can actually be in a viable, robust relationship that will help you. There's psychodynamic therapy, there's trauma work, there's CBT, there's group therapy, there's so much that can happen, right? And if there's medication, it's usually based on if there's depression or if there's anxiety that goes with this. So yes, you can heal these personality types. So you can heal the SPD, all right, but it needs to start with recognition. And it's to start with recognition. What would you like? Would you like to be connected to somebody? It needs to start very gently, because if you pressure them, they will leave. They will leave. So join our healing circle. Join our healing circle. So DM join healing. That's important. So we are doing this healing circle at the end of this 10-day blitz. Join healing. Some people don't need constant company, but we all need to feel seen. We all need to feel connected, and the schizoid personality makes that very difficult. As I said, we're interconnected beings. Not just being isolated, it's not living your best life. It's not living the life that would make you the best person of you, the best you, the best you. It will not help you with that. So if you or anyone you know lives with schizoid personality disorder, or yesterday paranoid personality disorder, tomorrow we're going to look at the schizotypical personality disorder, and we have we're going to have seven more to look at after tomorrow. We're going to talk about borderline personality, histrionic personality, all of you guys talking about your partners and naming them, who they are. Make sure you join the show. If you so make sure that you stay with me to the end of the 10 days. Make sure you stay with me to the end of the 10 days. It's a safe place just for us to build an understanding together. So DM me the words "join healing" on TikTok, or those of you on YouTube. Make sure that you let us know so that we can bring you back. So I'm Dr. Akindo Tamarino. Thank you for joining me in this conversation about the quiet world of schizoid personality disorder. Next, like I said, tomorrow, we will be talking about the schizotypical personality disorder. This is when imagination blends with reality. All right, imagination blends with reality. Let's talk about it. I will see you tomorrow, and thank you for joining me. All right, let me see. TikTok, how are we doing here? Woohoo! Thank you for joining, all of you. This is my second day on TikTok. Hey! All right, let's do this. All right, and we are going to get off. Thank you, everyone. Thank you for showing me love. Let's swipe to close. All right, thanks, everyone. Just have to figure out how to get off this. All right. Woo-hoo. All right. Thank you so much. Are we still live? Okay, looks like I am. All right, so we're ending.